From here you will get one question. The question 228408848 modifier 62 except true or false. You will get from there, or you will get to this code series. Above there will be a small paragraph. Definitely from there you will get. From here you will get one question. The question 228408848 modifier 62 except true or false. You will get from there, or you will get to this code series. Above there will be a small paragraph. Definitely from there you will get the answer. Next one, wound exploration. How you can get wound exploration in the exam is, see, if you don't know where you will get the scenario is, directly in CPT book index will be there. Index will be there at the end. Index will be there. In that index you will find the term wound exploration. Wound exploration. In that you can get wound exploration. From there you will get the answer. Understood, everyone? If you see here, this is the key term, wound exploration. You will get the code series. Take the code series and you can go there. You will get the guideline based question. If you are getting any guideline based question. Then the third question is 24925. Are you able to read a complete code or not? They are testing here. Okay. And then this one, surgical package. Before going to start the surgery section, you can see the guideline there itself, surgical package. Okay, this is ICD. Any doubts in that coding guidelines? Any doubts in up to question number 15? Up to question number 15, any doubts?
14, sir.
14. So which of the following code allows the use of modifier 51? In out of these codes, where we can code 51 modifier, where we cannot code 51 modifier, that is the rule. Add-on codes, we cannot use 51 modifier. Along with the add-on codes, we cannot use 51 modifier. Understood? Again, go for the index list. Appendix A, B, C, D will be there. Appendix A, B, C, D. Are you able to see that appendix in contents? There you can see one appendix, modifier exempt 51 modifier. 51 modifier exempt codes. Modifier 51 exempt codes. Are you able to?
Page number 910.
There you will get that question answer. Is that clear for you? Understood from where you will get the answer? Is that clear for you? Who have asked this question? Next, up to 15, any doubts? No doubts? 60 to 20. Question number? Question 1, 2.
Yes, sir.
Surgical package. I said already. Go for surgery section, first chapter. So you need to see at least the book, whole book, at least half day, so that you can understand where you will get all these points. Go for integumentary system. Before integumentary system, you can see general coding guidelines. Are you able to see, sir? Coding guidelines?
Yes, sir.
Okay. Their surgical package is there. From there, they have given this question. Okay. Try to read.
Okay, sir.
Next, up to 15. Any doubts?
Sir, can you please explain 15th question, sir?
See, 50. If you are searching for any code that you are not finding in category 1, you are finding that code in category 3, we can code category 3. Those are emergent technology codes. Emergent technology codes means new technology codes. Understood? Category 1, category 2, category 3. There are 3 types of categories. If you are not finding any code from category 1, you can go from category 3. We can code from category 3.
Okay, sir.
Okay. Next, up to 20. Up to 20. Up to 20. Up to 20. Up to 20.
Sir, in 18th question,
Question number?
how 18th, sir, how can we identify the burn 12 or 44% burn, 66% burns? How can we identify, sir? Here not mentioned in question.
So he came to the emergency department. He was treated for 2nd and 3rd degree burn on his face. You can see here. 2nd degree, 3rd degree burn on his face. As per the rule, which one we need to code? As per the rule, which we need to code? Only 3rd degree.
3rd degree.
3rd degree, right? Okay. Then here the question is not based on total degree percentage of burns. They have given by in a different way. If you go by the codes only, you can rule out this option. Understood what I'm saying? Then you can see 2nd degree burn on upper arm and forearm. 3rd degree burn on thigh. 3rd degree burn on face. 3rd degree burn on thigh. 2nd degree burn on upper arm and forearm.
Yes, sir. I rule out option A and C, sir. But in the difference is T31.42 and T31.64. That is the means burn person.
You are having different options already. If you see option B and D, T24.319A is there, T22.299A is there. You can rule out from there itself. They are not giving in terms of percentage there. We cannot go by T31.42 or 64. Understood?
Okay, sir.
You can go by the degree of burns in terms of rule out the options. Is that clear for you what I am saying?
Sir?
Yes.
Hello?
Up to 20. Yes.
Sir, coding concepts, we are looking for only index list, sir. Appendix list.
Not only appendix list, from anywhere they can ask. Nothing but coding guidelines. Those are wound exploration guidelines, surgical package guideline. If you are that guidelines, go for appendix or at the back, index. There you will get the main term. Go by the term and go for the code. You will find the guideline there itself. Understood what I am saying? For example,
Okay, sir.
wound exploration they have given. You cannot find
Yes,
an
sir.
index. Go for index at the end, CPT, not appendix, index. Wound exploration.
Yes,
or if it is scapulopexy, go by the term scapulopexy in the index. You will get the code. Read the code description. You will get the answer.
Okay, sir.
Move on this 19 question.
Huh?
This answer, I mean, we don't have to code OAT because it is mentioned that she has given birth to a healthy baby boy. So OAT should not come.
When you went through OAT, there is a clear-cut definition is there. without any instrumentation, no complications. The complications may be there but need to be resolved before the delivery. Then only we need to code O80. If you are going to code O80, you cannot code 009 category again. Understood? Normal delivery. No need to code other conditions.
Okay.
Okay, that is the scenario. Read the definition
Sir,
at
17th question explain.
read the definition at O80. You will get the information. Yeah, your questions you can text me so that it will be easy for me to look into your text. 17th
Yes, sir.
question, right? 17th question.
Yeah, yes, sir.
See, we can rule out here the options based on ICD. One is 812, another one is 822. You will get two options based on that we can rule out. Yes or no? Where is the problem the
Yes, sir.
patient is having? When she slipped
The
and fell,
she structured. Yeah, tell me, sir.
simple laceration to her left forearm. Simple laceration to her left forearm. Yes or no? Where is the problem?
The stove is the glass turn stove and which is started.
Forearm, sir.
Okay. Then you can see the external cause codes. What is the code you are getting? 812 or 822?
812.
8
8?
12.
812. Then A or C will be your answer.
C.
Okay.
Based on
A.
that you can rule it out.
Okay, sir.
C, sir.
See, you can go with external cause. Then where it is happened? Glass particles with kitchen, apartment kitchen, the location. Like that you can check. I need to check the codes. Do I need to check the codes?
Yeah, yes,
No.
sir. I'll check.
Sir, once tickets are 822 or 812.
Yes, sir.
I
Second,
got
sir.
822.
812. sir.
Right, sir.
S51.812, right? Laceration without foreign body of left forearm. 822, laceration with foreign body of left forearm. She presents to the ER with a simple laceration that has embedded glass particles means with foreign body. With foreign
body.
means 822. 822 is present in B
Yes.
or D. Understood? Then B is the answer.
Yeah, yes, sir.
B is the answer.
D. Yes,
Okay,
sir.
D for
D
Delhi.
is the
Delhi.
D for Delhi or B for Bombay? Do I need to check that code also?
D for Delhi,
D for
sir.
Delhi, sir.
D for Delhi.
D for Delhi.
Okay. Understood now? Embedded means
Yes.
within. Glass particles means foreign body. Anything which is not ours is a foreign body. Now, up to 20, any doubts? Okay. Lavanya, 21 is your doubt. HCP says Lavanya. Here, what is your doubt? A patient has a home health aide come to his home to clean and dress a burn on his lower leg. The aide uses a special absorptive sterile dressing to 50 square centimeter and 38 square centimeter is nothing but adhesive, self-adhesive sterile gauze. Lavanya, here what is your doubt? You need to read the code descriptions, that's it. Anyone is having doubt in question number 21?
Sir, 13, sir.
Again you are going back, Kalpana. 13.
Only one question.
Which of the following statement is false? Okay, this is all about external cause. External cause of morbid codes are in the range V to 9. You may assign as many external cause codes as necessary. That is true. External cause codes are only used in the initial encounter. That is false. Never be used as a. See, external cause codes they are telling only in the range V to Y. V W V S T U V W X Y Z. First option is true. So you can go with ICD. Are you there, everyone? Go by starting. You can see chapters are there. Chapter
009.
specific rules. Okay. In chapter specific rules, can you cause external causes? Chapter number 20. Contents. You can see chapter number 20. Chapter number 20. Are you there? ICD book. When you open the ICD book, starting before section 1, contents will be there. Yes, sir. Who have asked me this
Yes,
question?
sir.
Table of contents will be there in ICD.
Yes, sir. Yes.
There you can see chapter wise, chapter 20.
Yes, sir.
There if you see first one, external causes of morbidity. They have given the range, that is true. They are asking about which is the false statement here. Now if you see
Yes,
the
sir.
burns, you are getting more than one external cause code. That is also true. You may assign as many external cause codes as necessary. External cause code can never be listed as principal diagnosis. Then what is your answer? Which statement is false there?
Principal diagnosis.
Even
C is the, we cannot use it as a principal diagnosis. That is true. They're asking about which statement is false.
Okay.
External cause codes are only used in the initial encounter.
it's a false statement.
That is the false statement. We can use in the subsequent also. Understood, Kalpana?
Yes, sir. Okay, sir.
Next one, up to 20, any doubts? Someone have asked me question number 23. See, Geeta Kumari, the question is not based on percentage of the burns. The question is based on the concept first degree, second degree and third degree. No need to look for the percentage of the burns if you identified the proper code for first degree, second degree and third degree. You can sequence. When you are getting all the first degree, second degree, third degree codes are same, then you need to look for percentage of the burn. Here no need to look for the percentage of the burn. Understood?
Sir, but in answers, all answers have got the T31.42, T31.64.
All the options are
in this.
see where if you see B option T20.30XA, B option is same, but the second code one is 319, one is 299. There you can differentiate the option.
Sir, in that T31.42 is there.
T30. That what I am saying. No need to see this code. Rest of the codes. Try to rule out based on the rest of the codes. Understood what I am saying for you?
Sir, is it B is the answer there, sir?
Huh?
Then in this T31.2, then description burns involving 40 to 49% of body surface with.
Yes, I understood. That is percentage of burns. They have given the concept oriented question, but they didn't give percentage in the scenario.
Yes, sir.
And what I am saying is no need to see. There are 4 options in front of you, Geeta Kumari. 3 options A, B, C, D is not your answer. Then what is your remaining answer? B is the answer. No need to check for each and every code. It's a time waste. Here if you decided which is the third degree, which is the second degree, which is the first degree, then you can sequence based on that. That will be your correct answer. ఇక్కడ మీకు పర్సంటేజ్ ఆఫ్ బర్న్ కోడ్ ఇస్తున్నారు కరెక్టే, కానీ దాని మీద బేస్ చేసుకునే ఆన్సర్ లేదు కదా. వేరే ఆప్షన్స్ తో ఆన్సర్ ని రూల్ అవుట్ చేయొచ్చు కదా అంటున్నాను. పర్సంటేజ్ ఆఫ్ బర్న్ మీకు క్వశ్చన్ లో ఇవ్వలేదు, ఇవ్వనప్పుడు మనం ఫైండ్ అవుట్ చేయలేము. కానీ క్వశ్చన్ అనేది పర్సంటేజ్ ఆఫ్ బర్న్ బేస్ చేసుకుని మీకు క్వశ్చన్ డిసైడ్ అవ్వట్లేదు కదా ఆన్సర్. 3rd డిగ్రీ, 2nd డిగ్రీ, 1st డిగ్రీ బేస్ చేసుకొని ఆన్సర్ ని ఇక్కడ రూల్ అవుట్ చేస్తున్నాం మనం. అర్థమైందా?
ఓకే సార్, ఆన్సర్ రూల్ అవుట్ చేస్తున్నాం, కానీ ఆ రూల్ అవుట్ చేసిన ఆన్సర్ లో ఈ 31.2 ఉంది కదా సార్, అది మళ్ళీ క్వశ్చన్ కి లింక్ ఉండనవసరం లేదా అనేది నా
అవసరం లేదు కదా.
అది అవసరం లేదు గీత. మీకు ముందు అది మీకు కరెక్ట్ గా వచ్చింది అనుకోండి ఆన్సర్, లాస్ట్ వి 2 వేరేగా ఉన్నా మీకు ఫస్ట్ 2 ఆప్షన్స్ లో కరెక్ట్ గా అనిపిస్తే అది మీరు ఇవ్వచ్చు.
ఇప్పుడు గీతా కుమారి
ఇక్కడ పర్సంటేజ్ ఇవ్వలేదు కదా మనకి.
ఇప్పుడు ఫస్ట్ ఆప్షన్ తీసుకున్నారు అనుకోండి, బ్లైండ్ గా రూల్డ్ అవుట్ చేస్తామా? ఎందుకు 1 2 3 4 5 కోడ్స్ ఉన్నాయి, సేమ్ డిగ్రీ ఆఫ్ డిఫరెంట్ డిగ్రీ ఆఫ్ బర్న్స్ ఆన్ ద సేమ్ బాడీ పార్ట్. We need to code only the highest degree of burn. That clear, Geeta?
ఓకే సార్.
అందుకని ఆప్షన్ ఏ అసలు చూసే పనే లేదు. నెక్స్ట్ మీ దగ్గర ఏమున్నది? బి ఉన్నది, సి ఉన్నది, డి ఉన్నది. T20.09x అయితే ఆన్సర్ రాదు కదా, అది లేదు కదా సినారియోలో. అందుకని ఆ ఆప్షన్ ని రూల్డ్ అవుట్ చేశారు మీరు. ఇంక మీ దగ్గర ఏమున్నాయి? బి ఉన్నది, డి ఉన్నది. జస్ట్ మీరు T24.319 299 ఆ రెండిట్లో ఏది కరెక్ట్ ఉంటే అదే మీ ఆన్సర్ అవుతుంది. ఇంక మిగతా అన్ని చెక్ చేయటం ఎందుకు అంటున్నాను, టైం వేస్ట్ కదా.
ఓకే అంటే తెలుసుకోవాలి కదా అన్ని అని మళ్ళీ చెక్ చేశాను సార్, అట్లనే రూల్ అవుట్ చేశాను.
చూడండి, మళ్ళీ కన్ఫ్యూజ్ అవుతారని చెప్పట్లేదు. మీకు పర్సంటేజ్ ఆఫ్ బర్న్స్ ఇచ్చారు అనుకోండి, మీకు చెప్పటం లేదు అనుకోండి, ఇక్కడ రూల్ ఆఫ్ 9 అని కాన్సెప్ట్ ఉంటుంది. ఏముంటుంది? రూల్ ఆఫ్ 9. అది మీకు ఇవ్వరు, కానీ ఒకవేళ ఏమన్నా మీకు కావాలి అనిపిస్తే ఒకసారి డయాగ్రామ్ చూపిస్తాను చూడండి. మీకు క్లియర్ గా పర్సంటేజ్, దే విల్ గివ్ క్లియర్లీ ఇన్ ద ఎగ్జామ్ పర్సంటేజ్ ఆఫ్ బర్న్స్. ఇఫ్ దే unable to provide the percentage of burns,
సార్ అక్కడ ఆప్షన్స్ 2 సేమ్ ఉన్నాయి సార్, కాకపోతే సీక్వెన్సింగ్ చేంజ్ ఉంది.
then
సో
second.
దాని అక్కడ కన్ఫ్యూజ్ అయి ఉంటుంది.
Can you see here? Can you see this diagram?
Yes sir.
దీన్ని రూల్ ఆఫ్ 9 అంటాం. ట్రంక్ కి అప్పర్ బాడీ పార్ట్ 9%, లోవర్ అబ్డామెన్ 9%, బ్యాక్ 9, టోటల్ ట్రంక్ 36% వ్యారీ అవుతుంది. హ్యాండ్ 18% వస్తుంది, ఈ హ్యాండ్ 18% వస్తుంది, లెగ్ 18% వస్తుంది, ఈ లెగ్ 18% వస్తుంది, జెనిటీలియా 1% ఇస్తాడు. అలా మీకు అంత అవసరం లేదు అంటున్నాను నేను. ఇస్ ద క్లియర్ గీతా కుమారి?
ఓకే సార్.
రూల్ ఆఫ్ 9. నెక్స్ట్ 23, Manoj. 23, what is that one? See, this is an unlisted one. See, the drug is deleted, Manoj, but J9100, it's a different drug name. Yes or no, Manoj? Sriram? Manideepika. J91.
Yes sir, chemotherapy is there.
It's a different drug. Here it's an unlisted question. No need to think about it. Okay, I will ask the admin person to delete that question. They will give you the updated codes only, no issues. Question number 24 to 30. 24 to 30. Question number 24 to 30. Text your question numbers. Question number 24 to 30. Text your question numbers.
26.
26.
6.
26. See here. 20-month child is admitted to the hospital or not? 20-month-old child is admitted to the hospital or not here? Yes, sir?
Yes, sir.
Okay.
Yes, sir. Admin.
Then admitted NICU codes. NICU codes are 99471 series. 291 is just critical care, not newborn intensive critical care unit. BRD. Understood? Now in BRD, what is the after admission they are intubating the child? If you go and see the codes, I said there are some services included in NICU. In that you can see 31500 is included. I have already shown the codes.
B for Bombay.
If you go with the codes 99291 go with the codes 99471. Can you see page number 50 said for on that day? These are all the services included. Have you marked everyone? Page number 57. Yes, sir. Page number 57. I said on that day these are all the services are included. Now in that,
Yes, sir.
if you see the question, the physician spends 3 minutes intubating the child during that critical care services. That means 31500 is included or not? Then what will be your answer? D for Delhi is the answer. Understood? Those services are included. Next, any other question?
Mohan, critical care is not included, no?
In critical care, it is
I mean,
not
the
included.
treatment.
NICU, it is included. But here,
Yes.
okay. Just follow the coding tips. I already marked you all the rules in the textbook. Whenever you are getting a question from that codes, try to recall, is there any guideline you underlined in the textbook? Okay. Yes, question number up to 30. Question number up to 30.
29, sir. 29.
See, starting E&M, when you are getting this type of guideline based questions, when you are moving your pages also, you have to know. First page you can see in E&M. What is the page number of the first page E&M?
Five, sir. Page number.
Page number 5.
Yes, sir.
There you will get time is not a part of it. Time is not a part of it, okay? Understood? The guideline here you need to get. Give me 1 second. Established. Time concurrently counseling.
When it was saying coordination of care or counseling. Either coordination of care or counseling. but both are there.
Just give me that minute. We will discuss that question at the last. What is the question number? This was 29, right?
Yes, sir.
29.
nine page లో
Yeah, before that, you can check with 30 to 33 in anesthesia. Any doubt?
Sir, 28. 28 questions, sir.
28 question. Again, it
Yes.
28 is nothing but EFM. You can she's coming for annual examination. Established patient or new patient?
Established, sir.
Established, sir.
Established patient.
397 CRP, sir,
397.
answer.
Established
CRP.
code. D is the answer, right? Established patient means you need to code established code office visit. It's a straightforward question.
Sir, in 25th question, patient is observation, but I coded 99218, but this question is wrong for me. 99234, sir. Observation,
Admitted and
inpatient.
discharged on the same day from observation or inpatient. Admitted and discharged on the same day. What is the code series we need to use? If a patient is admitted and discharged on the same day.
2342
Okay, sir.
236.
2342 236. Next, up to 33. Any doubts? 33. Any doubts? Up to 33. Any doubts?
In 34th question,
34.
here we need to add the diameter, sir, 2.514.
Yes. No need to give here LTRT. Why? Because arm, left arm, right arm. When you are adding the diameter, again, why you need to give LTRT modifiers? By seeing LTRT, blindly rule out option A and D. Here we are adding the diameter, right? If it is there any complex repair, you can check. Any complex repair is there? No. Any complex repair
No,
is
sir.
there? No. Then simple repair, intermediate repair and simple repair. Then what will be your answer?
B for Bombay.
B for Bombay.
Sir, in what series, simple repair is included, na?
Where it is included, when it is performed along with excision, simple repair is included. Here only simple repair is performed to close a laceration. Excision followed by simple repair, then simple repair is included.
Okay, sir.
Yes. Any doubts up to question number 40? 39? Up to question number 39, any doubts?
Thirty-nine, sir.
39. See, you can tell me here. This I clearly explained. What is the question here? The size of an excision of a benign lesion is determined by adding together the lesion diameter. You will add the diameter here. Adding together the lesion diameter and the narrowest margin, the diameter of the lesion only, excluding margin, the depth of the lesion plus the full diameter of the lesion. Anyone can tell me what I said on that day? By seeing option C, we can rule out. Yes, sir. Yes, who have coded correctly here? This question, number 39.
I coded, sir. B is the answer, sir.
Adding together the lesion diameter and the narrowest margin. What you are adding here? Lesion diameter and the narrowest margin. When you are doubling the margin and you are adding the diameter, necessary. If you see option A, adding together the lesion diameter and the widest margin. See, if the diameter is 3 by 4 centimeter, what we are taking here? Highest diameter. Always keep in mind. If margin is 2 by 1 centimeter, then narrowest margin. Which one we need to take? Narrowest margin, and you need to double the margin and you need to add with the diameter. Highest diameter, lowest margin or narrowest margin. Keep in mind. Highest diameter, narrowest margin. Next, up to 40, any doubts? Up to 40, any doubts? Up to 40, any doubts?
Sir, for 38 question,
38.
F6, F
Finger modifiers, Appendix A. If you go for Appendix A modifiers in your CPT book, Appendix A modifiers in your CPT book, can you see page number 883? There you will find that one. See how we can memorize this one. Always keep in mind, everyone. The modifier starts in anti-clockwise direction from left to right. Left thumb is there, that we call it as FA, finger FA. Then 1, 2, 3, 4. Then right thumb is F5. Understood? Left thumb, from left thumb to right you need to come. FA 1, 2, 3, 4, 5, 6, 7, 8, 9, like that.
Okay, sir.
Next, up to 40, any doubts? No doubts. Then 41 to 45. 41 to 45.
41, sir.
41. Yes, what's your doubt here? Decision for surgery. Yes, sir. Decision for surgery.
Yes, sir. Here saying open. Yes, sir.
Okay. Now you can rule out based on CPT also here. 25574, 25605.
Sir, 25605 came on closed and 25574 is open, sir.
Okay, what
But
is performed here? Closed or open? What is the treatment?
Open, sir. But here Dharna is not saying in document.
Where is the open treatment here? The type of fracture is open. As I said, the type of fracture will never decide the type of treatment. Upon examination, the physician notes that there is a small portion of bone protruding through the skin. After ordering X-rays of the forearm and wrist, the patient is diagnosed with an open distal radius fracture of the right arm. The physician provides IV morphine. Absorbable sutures were used to close the layers. Closed with. Is there any open treatment done here? Nothing. Understood? As you said, what is the code description for 25605? What is the code description for 25605?
Closed treatment of distal radial fracture, sir.
That is performed here, not open treatment. Then they are performing the 54 modifier. Why? Because they are guiding you to go for, you can see here, it was then the physician provided the patient with a description and they instructed for her to follow up with her orthopedist. He is referring for orthopedist. You can go and read the 54 modifier. Understood here? First point, it is not a open treatment. Is that clear? No incisions, nothing was done. Rule out 25574. A and C ruled out. B and D you are having. Then why they have given 54 modifier with one code? You can go and see in the description last two lines. Follow up of orthopedic care is there or not? Sunil, go by that you can code. Up to 45. Any doubts? Up to 45. Up to 45, any doubts? Up to 45. 45.
Sir, can you explain the 44th question now?
44.
Hmm.
See here.
Once.
What is the use of 80 modifier? Assistant surgeon. What is the use of 62 modifier? Two surgeons are involved in the procedure. Yes, sir?
Yes, sir.
If you see here the scenario, general surgeon and neurosurgeon both are performing the procedure. No one is assistant here. Both are performing the same procedure or not?
Yes, sir.
Then what is the modifier, Sampath?
Okay, sir. I will check it.
62 modifier.
Thank you.
Okay. Both are involved in the procedure. Next, up to 45.
Sir, in 43 question,
Okay.
injected into 3 points in the muzzle.
Okay.
But answer was 20553, sir. 3 muscles. Single or multiple trigger points, 3 or more muscles.
Only one muzzle here, right? Only one muzzle is in the scenario. Yes, sir.
Yes, sir. 3.
20552. You can correct it as B. Not you cannot go by number of trigger points. You can go by number of muscles.
It's mentioned as 3 points in a muzzle. That means one muzzle.
One muzzle.
Okay, sir.
One muzzle. Up to 45. Okay. Up to 50, 50. Up to 50, 50. Up to 50, 50.
Sir, 47 question. 47 question. Chronic emphysema. Yes, 47, sir.
Yes. What's your doubt, Usha?
Chronic emphysema has surgery to remove both lobes. To remove both lobes of the lungs, sir.
Which portion of the
32482, sir.
See. On which side of the lung they are removing the two lobes?
Left lung, sir.
If on left side, how many lobes are there? 2 lobes. If they are removing the 2 lobes, means what they have done?
Pneumonectomy. Others.
Like that. Next, up to 50.
Okay, sir.
Now 50th question, this is an order related question. Femoral artery, I think so it comes under 36247. Yes or no? 36247?
Yes, sir.
Okay, A option, B option we ruled out. A option, B option we can rule out. Then what are the remaining options with Q, C and D? Why they coded 37253 into 2 times? Into 1 time you can check that procedure they perform 2 times or 1 time. Order related question up to 50. What is the 37253? What is the code description 37? See, first of all, everyone, are you able to rule out A and B? 50th question, A and B, are you able to rule out? Yes or no?
Yes, sir. Ruled out.
Yes, sir.
CRD.
Yes.
In CRD, where is we are having difference here in 37253? Go for in 37253. 37253. Each additional non-coronary vessel. How many non-coronary vessels are there here? A cardiologist manipulates a catheter. Manipulates a catheter arterial system starting in the femoral artery and manipulated to the third order using intravascular ultrasound. The cardiologist performs radiological supervision and interpretation. Now you can tell me how many arteries? 3 or only 2? How many of you coded C is the answer? Anyone coded C? 50th question. Sunil.
D. I have coded D, sir.
You coded?
D. D for Delhi.
Okay. Why you coded D for Delhi, Sunil?
I think 2 only, sir. That's why I am.
Okay. Not accurately, you don't know. Okay. But your answer is
Yes,
right.
sir.
50D is right answer.
Why,
Mohan, that
sir, please explain that. Why C is not correct, sir?
See, your option is right or wrong? Wrong, right?
My option is right, sir. D. My option is D.
Okay.
Sir, can you show this in vascular families appendix L, page number 917?
Okay. Why you coded? Anyone coded C is the answer? No one in the class?
No, sir.
No one in the class. Why? See, first order, second order, third order. Total how many arteries they are passing? Non-coronary arteries. 1, 2 or 3? The catheter. How many non-coronary arteries they are passing? You can see here. First point, they are placing in femoral, right? Femoral, you can see thoracic aorta, abdominal aorta. Here you can see femoral, common iliac, femoral.
Common femoral, that one.
From here it is passed to
Common femoral is there.
where?
Down, na, in abdominal.
Common iliac.
हाँ see external iliac, second order this one.
Yes. They from there
And
they
there
move
it is
to third order. Yes or no? From there it is moved to third order. Understood what I am saying? How many non-coronary arteries it has passed to move to third order? First order, second order, and third order. Yes or no? If you read the code description, if you read the question, to the third order like that it reached means how many non-coronary arteries it is passed? Total 3. First order, second order, third order. Understood what I am saying? That's why the answer is first non-coronary artery 252, 253 into 2 times. Yes, someone have asked me what I need explain here up to 50. Up to 50, what I can explain for you? Anyone is having any other questions? Up to 50. Sunil, you understood the concept here? Why 3 times here?
Yes, sir. 3 orders is there.
3 orders is the total 3 non-coronary arteries they have passed. Up to 55.
Yes, sir. Yes, sir.
Up to 55.
Mohan 49. Mohan 49. 49.
Yes, 49. What's your doubt here? A patient undergoes endoscopic
They have
surgery
done.
to remove his anterior and posterior ethmoid sinuses. The surgeon dilated the maxillary sinus with a balloon using a transnasal approach. Remove 2 polyps from the maxillary sinus and then perform the tissue removal.
So they have done multiple procedure for maxillary sinus dilatation. They have done. Then they have removed the polyps and tissue removal. They have done. So I had gone for A, but answer is given C.
Dilation is doing for only maxillary, no?
Read
It's bundled.
Read the question properly here and you can see the parenthetical notes here. You will get the correct answer, Anupama.
Which one? Where?
Read the parenthetical notes properly and the question properly. 31255.
Answer is C, I think, sir.
Okay. Read the code 31255.
Mohan, this is saying nasal sinus endoscopy surgical with ethmoidectomy. Total anterior posterior. It is covering ethmoid.
That is performed here by the physician. Okay. Next. 31267.
It is again nasal sinus endoscopy with removal of tissue from maxillary sinus.
Okay. Then you can see below parenthetical note. Is there any parenthetical note like that? 31295 cannot be reported like that. Anything is there?
Okay, 267 should not be reported with 31237. It is saying.
Is there or not?
Okay. This note is. That's why we should not. We have to go for C.
Yes. Up to 55. Up to 55.
Can you explain the difference between excludes 1 and 2 again?
Exclude 1 means those two conditions will never be coded together. From the two, only one code you need to code. Exclude 2 means both the conditions can be coded together.
Thank you.
Okay. Next, up to question number 60. 60. Question number 60. Question number 60. 60. 60. 60. Yes, Sunil. Up to 60. Any doubts? Anyone? 60. 60. Anyone? Anyone in the class?
48. 48. A or B option is given in answers.
Which one? 40?
48.
AR?
48.
ARD is given in the options.
Sir.
The thoracic surgeon makes an incision under the sternal arch at the base of the throat, introduce the scope into the medial sternal space, and take 2 biopsies of the medial. He then retracts the scope and closes the small incision. 3, 9, 4.
Actually, B I have coded B for Bombay. But answers are given A or B. So B is correct, I think.
Biopsy. 39401. B is the correct answer. B is the correct answer, everyone. 39401, it's nothing but lymphoid system. That is mediastinoscopy, including biopsies, mediastinal mass. Introduce the scope into the mediastinal space and 1 second and take 2 biopsies of the mediastinal mass. See, A is the correct answer here. Why you coded Anupama B? Can you tell me? Where is here thoracoscopy?
It is thoracoscopy only, na? They have introduced scope into mediastinal space, they have mentioned.
If you read the code description 39401, it is mediastinoscopy. And then what is the purpose of removing those biopsies? Because of mediastinal mass. Read the code description, you will understand. 39401.
But if you read this one, 32606, then it is thoracoscopy. Thoracoscopy is not the needle
It's not
biopsy.
thoracoscopy, only mediastinal space examined. Thoracoscopy means total thoracic region like pericardial sac, mediastinum, everything is examined. Introduced the scope into the mediastinal space. Not into the thoracic region. Okay?
Okay, so 39401 answer. Okay.
Up to 55. Any doubts? Up to 60. Any doubts? 60, any doubts? 60 to 70, up to 70 you can check everyone. Up to 70, 70. Text me your doubts. Up to 70. Now check everyone up to 90, 90. 90. Before 90, any questions you are having, any doubts? Now, everyone can tell me the scores. Text me privately up to 90 how you scored. Yes, Susha. 62.
66.
66. 62 Shobha. When reporting delivery only services, the discharge should be reported by using an E&M. See why here we need to code discharge with E&M code, Shobha. Can you go with delivery services? Shobha at that 59431 series. Yes, someone just go through it. I will like. Someone have asked me 60.
6, sir.
66. Yes, what's your doubt here?
Here, corneal tissue from donor is frozen, reshaped, and implanted into the anterior corneal stoma
Okay.
of the recipient to modify the refractive error. I coded 65710, sir. But answer is C.
Can you read?
Keratophakia.
Keratophakia means kerato means cornea. Phakia means lens.
Lens, yes.
65710. That is only corneal transplant. 65765 keratophakia. See,
okay, sir, but I didn't.
You didn't? Cornea is
Understood the
transplanted,
question,
right?
sir.
Cornea is transplanted, right? A
Yes,
procedure
sir.
in which corneal tissue from a donor is frozen, reshaped. Okay, just note down. I will give you the definitions by the end. Okay? Keratomycetes,
Okay, sir.
keratophakia, keratoprosthesis. These three I will give you at the end of the paper.
Okay, sir.
Next, Shobha, did you find that one?
Sir, for 66, which one is the answer, sir? A or C?
C is the answer.
C. Okay, sir.
Manidipika, billing.
It's not corneal transplant.
Is billing questions we will.
Transplant, sir.
Yes, yes.
It's not corneal transplantation, sir. 66.
Yes, yes. No.
Okay.
Manidipika, billing questions we will provide you before going for the examination. Okay? Don't worry about those two questions. Regularly, only focus on first priority is CPT, then next priority is ICD. Okay? Shobha 62, you got the clarity? Go for delivery service.
No, sir.
Go for 50,000 series delivery services. Maternity care and delivery is there. Are you there?
No, sir, I'm not finding it.
Go with the code 59000. 59000.
Yes, sir.
Okay. Can you see their maternity care and delivery?
Yes, sir.
Third paragraph you can see simply they will give guideline based questions. Directly you can go the scenario. You will get the answer. No need to memorize. Delivery services include the third paragraph. Are you able to notice?
Yes, sir.
Okay, read that one. You will get the answer. Okay.
Okay, thank you.
Simple. See where I got why I went like this. See, even I don't know. For example, how I can justify where I can get this answer. This delivery they are asking in the code series 50,000 series. Shobha, are you understanding how I am going through that question? This question I got in
Yes, sir.
50,000 series. In 50,000 series where I got delivery, okay, antepartum care and delivery. I went directly with the first code. The guidelines wherever it may be, it is in the first line itself. Okay, before going to start the concept, if there is any guidelines are there, they will note that one. Like that I went through it and I find the answer. Okay, just a little bit lost.
Okay.
Yes, 66 I will explain those terms everyone. Up to 90, any question you people are having doubt? 90. Now can you text me your scores up to 90 except those 10 coding scenarios, how many you scored? Or you can text me your total score privately, no need to tell me your score also. How many marks you scored?
Mohan, I had solved this mock one, which was in the hard copy, so it is different from this one, which is shared as a mock one.
Why?
I thought that this question 2, 3 were same, but I think questions are changed in this soft copy, whichever is shared, no? And hard copy has different question pattern, mock one.
See, Anupama, at that time when we provided you the soft copy, that is 150 question paper, right? Understood?
Yes, 150 questions.
Now this is now the question paper has changed. That's why we are providing soft copies for you. 100 question paper. We modified the paper. Understood?
Okay.
Follow the admin person. Don't do that papers. Huh? We can do this one.
Okay.
Yes. So the people who got 50 minimum out of 90, they are in good position initially. We need to reach up to 70. More than 70, it's good. Minimum 50 we need to score. Any person scored less than 35. Less than 35 means they are not at all prepared. 35 to 50, okay, they have some knowledge but not practiced. Minimum 50 if you scored, then okay, we are on the right track. Understood everyone? Okay, now see the last 10 questions, case studies. Case studies. See, for procedure related case studies, how to do. See, 100th question, it is not that much difficult to code. Yes, sir. 100, it is not that much difficult to code. Anyone faced any difficulty in 100? No, I think so. Then 99 also, it is just diagnosis related. I hope so you coded properly. You need to find out whether it's a benign lesion or a malignant lesion.
Malignant, sir.
Okay, you can code right then. No issues with that. Okay, then question number 98. Now listen, this type of questions how we can code. Try to read the code descriptions first, everyone. Don't read the question. Try to read the code descriptions. What is the code descriptions? 33400405411. Try to read the code description. Only one code. Then read the question initially. The procedure performed, they will clearly document here. Medial sternotomy, like that. Then you can match with the code description. Then you can find out the answer easily. Understood what I am saying? For example, if you see this question, 334004005, we can see 334004005. 334004005. Double 334004005. What is 40?
400 code is not there, sir.
It is deleted, I think. So then come with 405. Replacement, aortic valve, open, cardiopulmonary bypass with prosthetic valve other than homograft or stentless valve. 33411. Replacement, aortic valve with aortic annulus enlargement, non-coronary sinus with cardiopulmonary bypass with prosthetic valve. Now you can see the patient operating room. She went to cardiopulmonary bypass. Is there or not? In the fourth line. Are you able to see here? The patient was brought to the operating room. She went on cardiopulmonary bypass. Are you able to notice that one?
Yes, sir.
Okay.
Yes, sir.
Cardiopulmonary bypass. It is under 33405. It is in the option B and C. Understood. Then no need to check for 33533. The only thing we need to check here is 33517 or 510. Now you can see here. As we discussed in CABG, no two primary codes will never be coded together. 33533 and 510 will never be coded together. Artery, vein. For vein, always we need to use the add-on code. Try to recall that rule. Yes or no?
Yes, sir.
Then what is your
Yes, sir.
answer? B is the answer. Simple way. I just rule out the options based on the codes itself. First I went through the code description. Then I went through the question. I came to know this is CABG. Easily I ruled out option D and A. I came to know 33405 is the one. Why? Because cardiopulmonary bypass is going on. Then CABG, I recall the rule. Artery plus vein. I hope so understood everyone. 98 how to solve. Next 97 also. Try to read the code description first and then read the question. Any difficulty in doing 97? Any difficulty in doing 97? Anyone? Any difficulty in doing 97? It's a straightforward one. Try to check and code. Next, question number 96. Question number 96. Read the code description and then read the question. Okay, regarding these ones. Now come to the E&M. See, in E&M, don't look for history physical exam. Try to focus only on assessment and plan. Why? Because if you go through the code descriptions 2022 and 5, they are mainly based on what? Mainly based on MDM and time. MDM and time only you can check with MDM and time. Prescription of medication. Prescription of medication comes under moderate level or not? See, there are two levels for you. One is 203, 204. Prescription of medication. If you only see the MDM table, the management option, where is the prescription of medication? Where is the prescription of the medication? See, recall that MDM table, everyone. Put the MDM table in front of you when you are doing the type of questions. Go for MDM table. See, when you are doing initially, you are facing little bit difficult. When you keep on doing, you will get the concepts. Can you see this table, everyone? My screen. Can you see here prescription drug management? One acute or problem, one acute illness with systemic symptoms. Are you there? You can see here. Can everyone see my screen? Then comes under 204. What is the main problem the patient is having? Chest pain. Next one, if you see the question number 92, prescription of medication is there and progression of a chronic condition is there. If you go and see again, if you see the moderate level, one or more chronic illness with exacerbation or progression of the disease condition with drug management. What is the code? What is the code? 204. Yes or no again? Here the patient is an established patient, that's why 214. Next one. If you see only follow-up is going on, no medications, nothing was ordered. Just they're continuing the medications. That means they're just doing refilling. Refilling comes under low level. See, how many of you out of these three questions you face any difficulty? Out of those three questions, E&M, level evaluation, how many of you didn't understand anything? Okay.
Sir,
What I'm
sir,
Yes, yes.
sir,
Yes.
once explain me
What you need?
where to focus, sir. This case studies questions, where to focus mainly.
E&M only MDM. MDM.
ENN.
Only MDM. Remaining case studies, just read the code description and then read the question. The 10 case studies only practice today. Again, you will get an idea. Follow like this what I am saying.
Okay, so can you explain again this MDM table, sir? How to use this?
Can you see here my screen? This is number of diagnosis column and management column. In one column, you can see chronic condition, osteoarthritis is progression of a condition. You can see it is under moderate level or not. Can you see my screen here? Then prescription of drug is done. Prescription of drug and chronic condition is under progression. It comes under which level? 99214. Yes or no? Double 9214. Yes or no?
Yes, sir.
Okay, like that. Say compared like that the table. Okay, prescription of drug and the disease condition. Disease condition you need to look here this column and prescription of drug here. Mostly low moderate. Try to focus on low and moderate. Okay.
For case studies, we have to look this table, sir.
For E&M.
Okay.
E&M.
Sir, and in
Sir?
normal case studies questions,
Okay.
it is there as preoperative diagnosis and postoperative diagnosis
Consider
operation
only
performed.
from post-operative diagnosis.
Okay. Only postoperative.
Next.
And after reading the code descriptions, we will focus on procedure, right?
Yes. That is easy to rule out the options. Very easy. Make it as a habit from today. Okay, within 3 marks you will get an idea. Yes, next one. Someone is going to ask.
Sir, in 91 question, she is not new patient, sir.
91 patient. 91 question, right?
Yes, sir.
Can you read the question, Priyanka?
62 years old is here to follow up on her
Follow
atrial
up means what,
fibrillation.
Priyanka? New patient or established? Follow up.
Established, but here she is the partner. Her partner is treating her here, no, sir.
Her partner means what? In the absence of one person, another physician is doing the procedure.
Okay. Okay, sir. Thank you.
Okay. Next.
Mohan, continuation of medication considered under
Refill.
which
Just low.
low only.
Yes. If they are ordering new one or updating one, then it is moderate level.
Means prescription refill is low level. 213 it will go.
Yes.
Okay.
Now write down few definitions, everyone. Keratomycetes. KE.
Sir, what is this compliancy and regulatory, sir? Under this, there are 3
billing
questions.
guidelines. That is billing questions. You will get 3. We will get those 3 questions for every batch from the persons who have written the exam. Don't focus on that. Focus on CPT and ICD. Okay. We will get that questions what you are getting in the exam. Yes. Next one. Write down keratomycetes. Keratomycetes. Surgery in which a middle layer of corneal tissue is removed. Corneal tissue is removed and reinserted to improve visual. To improve visualness. Next one. Keratophakia. Surgery in which a layer of donor corneal tissue is removed. and inserted into patient's cornea. And inserted into patient's cornea. And inserted into patient's cornea. Next one, keratoplasty. 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 Plastic surgery on cornea. Plastic surgery on cornea. Plastic surgery on cornea. Next one, keratectomy. Keratectomy. Removal of corneal tissue. Removal of corneal tissue. Removal of corneal tissue. Next, any other questions you are having?
Mohan, can you tell about conscious sedation, when to use and with which procedures to be used?
Which one?
Moderate sedation or
Which one?
conscious sedation or moderate sedation?
See, conscious sedation or moderate sedation both are same. Anesthesia codes and conscious sedation codes will never be coded together. When we can use, if physician documents he or she used conscious sedation, then they must document time. Then only we need to code. Understood? They need to document time. See, someone have asked me, vitrectomy. Vitreous is nothing but aqueous chamber. That means after lens to retina, that space, what we call it as vitreous chamber, removal of that space. After lens to retina, the middle portion, the black portion, the dark portion, what we call it as vitreous. Next one. That's it. Everyone.
Sir, in cardiovascular, one family is pending.
Family, venous family.
Yes, venous.
When I am discussing the next mock paper, at that time I will discuss those codes. Okay.
Okay, sir.
Yes.
Sir, can you please arrange only one mock test for a week, sir?
No issues. You can write like the same.
Admin person, I have arranged 2 mock tests for a week, so it
the persons who are willing to write the exam in the month of March, they can take 2 exams in a week. Okay. The persons who are willing to write in the month of, you can say later, you can write 1 mock exam per week. That depends upon you, Vishnu. Okay.
Sir, if it is better to do 1 mock exam for 1 week, sir.
That's your wish, Shobha.
Because I think 4 weeks are there. 4 weeks are there for March. We can do.
Okay. No issues.
We'll discuss only on Sunday, sir.
Yes. No issues.
Because I have to give the.
Yeah.
So it will be easy to discuss. It will be easy to discuss also, sir.
Okay. No issues. You people can do like the same only. Okay. 1 mock paper, 2nd mock paper by next Sunday.
Sir, I'm doing exam in Feb.
Okay.
So I will do both mock tests, sir.
You can write, Priyanka. When the mark paper 2 completed the discussion, then you can ask me your third mark. Only you can ask me. Okay. I will try to
Okay,
clear
sir.
all your doubts. No issues.
Yes, sir.
Okay. Remaining people you can do only 2. Okay. Second mark. We had any confusion regarding? No need to confuse Manadipika regarding anatomy. Okay. The notes, and you have practiced this paper. Okay. From the notes, maximum questions you got, right? No issues. Okay. Please
Sir, in
practice.
coding concepts,
Yes.
sir, for coding concepts, what we have to focus, sir, mainly?
Nothing. It will be
Coding
in your book
concepts.
itself. I have shown you already. Sometimes you will get a question from appendix A, B, C, D. Sometimes you will get a question from index list. Okay. You can see from where you are getting that question. Try to analyze where you will get that concept in the book. Go there and you can get the answer. No need to memorize anything.
Okay, sir.
Try to analyze yourself, so that I have shown you today, like that I can show you 2 to 3 marks, then you will get an idea how to look for. For interview purpose, just prepare anatomy, modifiers and ICD guidelines, Dimple. No need to go for extensive this one, CPT. Anatomy, modifiers and ICD guidelines. ICD also especially some general guidelines and hypertension, CKD. Just go through my notes, it's enough.
Okay, sir.
Okay.
Okay, sir.
Still any other questions? Can I close the session for today? Okay. See you next Sunday. Please try to do in the morning time only. We will conduct the doubts discussion session. Okay. Thank you.